Good evening. I'm Dr. Greenbrier Almond, and thank you for joining us on our program, Tender Loving Care. Each week on Channel 3, I'm happy to talk about this interface between Christianity and medicine. And tonight, I'm going to be talking about something that we, as doctors, deal with every day, and that's we fight against death and disease. But there are some diseases that are more unusual than others, and that includes suicide. And I want to lift up the fact that West Virginia's governor has just signed a bill which is authorizing a great deal more education about suicide prevention. And this is particularly in the age group of young people, high school and college age group, where suicide is the third leading cause of death behind homicide and accidents. Some 34,000 people commit suicide in the United States every year. As the governor, Governor Tomblin, pointed out in an assembly up at Morgantown at the high school where he announced that he was signing this bill and where he signed it, he said that 15 times a day some American family agonizes about the loss of their loved one, their teenager, their early 20-year-old otherwise healthy person, suicide, 15 times a day. And so I'm going to talk today about what the governor is setting in motion, what our own delegates and senators did for us here in West Virginia this year, just signed last Tuesday. And I want to talk some more, of course, about other aspects of suicide as a physician and what we know can help. And as you watch this program, you'll see a banner along the bottom, 1-800-273-TALK, T-A-L-K. This is a national suicide hotline prevention number. Or if you need to get other information, support groups or treatment centers or something you want to know about, you can call that number, 1-800-273-TALK, T-A-L-K. And it's been shown, for example, that if people have suicidal ideas, maybe they have thoughts of suicide, maybe they have intentions, maybe they're making plans, anywhere along the way, if they talk to someone for as little as 15 minutes, maybe they will think better about the suicide. In other words, postpone it, decide not to do it, go get treatment. If it's a teenager and they're watching a program like this, or they call that number, 1-800-273-TALK, maybe they'll talk to their parent, a teacher, a principal, a minister, someone that they can trust, and they'll get the help they need. So it's vital that we talk about this subject. And by the way, there's been a great deal of medical literature in my 40 years of medicine that show that anyone talking about suicide, that is a nurse, a doctor, a teacher, someone bringing the topic up, does not put the idea into that person's head that they ought to go ahead and kill themselves. In other words, it's a welcome comment. If someone says, you look worried, how worried are you? Don't look yourself, how are you doing? You know, it can bring it up in various ways, and people want to talk about their feelings. Now, I also have, and there's different layers to this talk tonight, obviously. I wear different hats as a doctor. I've had a career at the VA. I have a shirt on today, and it just says, all gave some and some gave all. And I decided I would put that on today as a further emphasis that even with our soldiers who are fighting right now in Afghanistan and are beginning to stand down in Iraq, more soldiers are committing suicide this year, 2012, than are actually dying in the field of battle. So that's a tragic number in a way. But for them to, and some will be watching this maybe on YouTube, maybe they're getting special instruction by their sergeants and other people in their leadership in their units about suicide. Everyone is concerned about this. And so let's talk a little bit about it from a detailed standpoint. First of all, with what West Virginia is doing, and what the governor in particular did last Tuesday in Morgantown. As I mentioned, this is I think he's very bold to talk about it now, and to our own House of Delegates and our senators were very bold to pass this law. This is based upon a Jason Flatt Act of 2012, which has been passed in other states. We're not the first state to do this, but Jason Flatt was a young man, a 16-year-old man, a young lad really, just in Tennessee, and his father, following his suicide, Jason Flatt's suicide, has started Jason's Foundation and has advocated for this type of prevention law that we have put in place in West Virginia. It's been before our own legislature 3 times before being passed this year, and our governor signing it. And so hats off again to the Jason Foundation for their persistence in getting a law passed here in West Virginia. Jason, just to use an example, I don't want to use clinical examples on a program like this, but use Jason since he is the basis of this law. His father said that he earned B's and C's, he was a good athlete, he was active in his church. The father did not think that his own son was the kind of person who might commit suicide. And Jason's father, as part of this, wants students to be taught, wants teachers, principals, scout leaders, church leaders, a whole bunch of people, all of us really, to be taught about this, that first of all, friends are going to know more if something's not right. Sometimes friends talk with each other, and maybe they know that a classmate is struggling. 4 out of 5 times, when you go back and do an analysis of the suicide, the completed suicide, 4 out of 5 times, there have been pretty clear warning signs that either were ignored, people didn't realize they were warning signs, and of course 1 time out of 5 it happens, suicide happens, and no one knows, no one can find out why it may have happened. But 4 out of 5 times there are certain things that we're going to talk about tonight that are warning signs. Different students up at Morgantown High School, as they listened to the governor, were then interviewed by Vicki Smith of the Associated Press, and for example, they said that they're concerned about bullying, which is certainly something that has led to suicide in some cases, and the students were aware of that. They were also aware that drugs and alcohol are used in suicide, and that's an issue for teenagers too. So the governor is now advocating for more education of all of us here in West Virginia about suicide. So let's do a little bit of that tonight on our program, Tender Loving Care. I'm going to use some information that I've just, again, hot off the press. This is promoting health from the American Academy of Family Physicians, and it's a talk about the suicidal patient, March the 15th issue. So here the governor is talking about this on March the 16th. Here we are talking about it tonight, just a week or so later after a lot of this information hits the press. Well, first of all, I mentioned, and I'll emphasize again, this hotline number, 1-800-273-TALK, as a way to get more information. But if someone is suicidal and you could call a family member, someone has called that number, they're going to say, get the weapons away, get the medicine away, get the Tylenol away, whatever the suicidal person may be tempted to use, knives, all those things. We have to store those away from the person so that they don't do this act impulsively to hurt themselves. In many cases, of course, in all cases, that person should not be alone. If suicide is on their mind, someone needs to be in attendance. Of course, it could be that the person should go to an emergency room or call the family doctor. It's thousands and thousands of times a year there are suicidal visits of family members, loved ones, patients coming to emergency rooms all across America. and they are suicidal, and that's the reason that they're coming to the hospital. So doctors are used to dealing with this, and we're going to help out in different ways. We're going to, for example, someone may need to be observed in a hospital, voluntarily go to one of our psychiatric units in West Virginia and get help. Someone else may need to be observed at home, and family members and all that can be worked out in the ER. But it begins with someone recognizing that there's a suicidal person, family member, and we start to get help. Take away their weapons, help them get help. There are different ways that this, of course, can be treated, and different reasons why someone will do something. And I'm going to talk about some of those red flags. These are factors that are associated with suicide. It doesn't mean these are the only ones, but if you as you listen to this, you think that you know someone who may have this, then get them help. We have an 800 number here for Appalachian Community Health Center. We have the 24-hour service at St. Joseph's. These are places to begin to get help. But here's some risk factors, some red flags. 4 out of 5 times the governor says these can be identified. First of all, the age group. Teenagers up to 24 years of age. This is a leading cause of death. This is the 4th leading cause of death, clear up to age 65. As you know, older people die of stroke, heart attack, cancer, various things like this, but suicide is a big cause of death all the way through from teenage years all the way up to 65. People who are American Indian, Alaskan, Native, white are more likely to commit suicide than other people. Men are more likely to commit suicide, though women will try 4 or 5 times more often. Men will use more lethal means, like weapons. Psychological things that people may complain about. One big one is called anhedonia, just that ability or inability to experience pleasure. People will say everything's flat, it's blah, I'm down, I'm blue, I can't enjoy life anymore. We've been having wonderful spring days, and when people don't enjoy these days, then that doesn't mean they're going to commit suicide, but it's called anhedonia, and it's one of those red flags. If there's history of a suicide attempt, either personal or family, it often seems to run in families. And many times when I'm taking receiving a history from someone, I'm asking, do you know anyone else who ever committed suicide? And they will describe 2 or 3 or 4 or 5 other people in their family who's done that. So in a way, there's a taboo against it. It's not something that any of us want to see happen, but if that taboo has been bridged and it's happened in a family, it seems to give permission for say, a younger person to try that or consider it. Even if there's a suicide in a school system or among a circle of friends, there might be more suicides that follow, as if there's a pattern that the door has been opened. So that history of suicide attempt becomes very important. Hopelessness is another issue. People can hold on for a long time, but if they feel without hope, then they start to think of suicide. In medicine, we often deal with having to make a hard diagnosis. It's very hard to tell someone, you have a cancer. It's a serious cancer. You may die of your cancer. You know, that type of message we try to give to people. We want to give them time to digest it, family members to hear the same story. But we don't want to create hopelessness by giving that message. But some people feel hopeless when they receive bad news. Many times suicides follow someone getting bad news. It's interesting, and I know, and my hat's off to our soldiers. I'm wearing this shirt again to say I have greatly enjoyed taking care of the patriots who defend our liberty. But some of those men and women, 4th deployment or more back to Afghanistan or Iraq, they become suicidal. Maybe they feel hopeless. Maybe there's something there. Maybe they feel like this time they're not going to make it home. They're going to die. Hopelessness comes in many ways. Insomnia is a big issue. A lot of people cannot sleep for one reason or another. They worry about things. It's behind breathing, which causes a lot of anxiety if you cannot breathe, of course, but inability to sleep is a second physiological drive that we require for life. So insomnia is a very major symptom and a pattern that you see in people who may become suicidal. A lot of people combine or try to knock themselves out with alcohol or drugs. Doesn't work, and of course the body will feel stimulated when the drug wears off, and then they can't sleep all the more. Various issues with insomnia. Another problem is irritability, a red flag. Easygoing people, people who you enjoy being around, who are happy and easy-go-lucky. If they become irritable, that's a red flag. Something's wrong, and that could be the beginning of a thought, an intention, a plan for suicide. Psychiatric history is often an issue. A lot of people who commit suicide suffer depression. They suffer schizophrenia, a bipolar illness, diseases that I, as a physician, take care of. But all those diseases have a beginning. For example, schizophrenia often begins in someone who's about 16 years of age, may have their first psychotic break. Unfortunately, these drugs, these bath salts and drugs of this nature, which are illegal, but when young people take them, they may experience their first psychosis. Marijuana is an hallucinogen. People want to argue that maybe marijuana could be legalized. Well, it causes hallucinations. Hallucinations can be command hallucinations, and people may hear voices or feel an inner command to do something, like kill themselves, and they do. They follow that lead. So these drugs are dangerous. The first psychotic break is dangerous. Depression, anxiety, panic is dangerous. More people commit suicide who are in the midst of a panic attack than almost any other reason. A lot of people again come to emergency rooms saying, I'm having the big one, I'm having a heart attack. The doctor does all the tests and he says, it's not a heart attack this time, it was a panic attack. So we did a study at the VA several years ago when I was there, and of all the people that complained of chest pain that came to the ER, about 22% of the time it was actually a heart attack. The rest of the time, about 78% of the time, it was a panic attack bringing them to the ER. And some people do commit suicide in the midst of a panic attack. So some type of psychiatric symptom. I mentioned that severe anxiety, but also let me emphasize substance abuse, drugs and alcohol. About half of all the committed suicides are the person who does this are intoxicated. This is about the same for murder and other bad things. A lot of accidents occur, of course, traffic accidents and things where people are fatally injured. That one of the party is intoxicated, and it's a tragedy of our culture that we have so much drugs and alcohol available, and that could, it's a different program, but that could end our culture as we know it. Given the prevalence of drugs and alcohol, but certainly it can lead to suicide. Environmental and social problems, well, availability of means. I mentioned if you have a loved one who's considering suicide, first thing to do is get the guns away, get the medications away, get the knives away from the person, protect them from that impulsive act. And so having means available does lead down that road towards suicide. Changes in future plans. If people begin to make their funeral arrangements, they begin to make out their wills. I'm not a lawyer, I'm not really around lawyers that much, but I would imagine if I were a lawyer and someone came in and they said, I want to make a will, I would ask, I'd say, well, why do you want to do that at this time? And of course, they may need legal advice and go through that process, but people maybe on the way out, they are trying to write down their last will and testament. Recent illness, chronic disease, major disease, people sometimes misunderstand what the doctor's saying, but that doesn't mean that they don't consider suicide. I know doctors a lot of times will after they have that first meeting, they want to have another meeting, another meeting, another meeting. They want to make sure that the patient understands what's going on. So bad news, we ought to go over that several times. I've had pastors tell me that they feel like they need to give a certain message 4, 5, 6 times before they believe it's heard by a parishioner or someone's worshiping in their flock as a pastor. So recent illness, a diagnosis, some bad news can lead people down towards suicide. If there has been more suicides in the community, in the nation, we have this rash of suicides the military is dealing with, and this surprises everyone. I mean, it's multiple times greater than it used to be. Even in Iraq, before we saw our own soldiers committing suicide, we realized that there were suicidal bombings there. The people were strapping bombs on them and going into restaurants or police stations and blowing themselves up. And it sounded odd to Americans that anyone would do that. But in that culture, suicide is something that's accepted in that culture. So cultural means, states, nations, all this type of thing. Why would we now in West Virginia become one of multiple states to have a law to teach people about suicide prevention, unless, of course, it's necessary that we do that? The governor was right to say it's the third leading cause of death, he said, in his statistics, and I've heard the second, the third, the fourth, various numbers. It depends on how you cut that, but a very, very high prevalence for suicide now in our culture. Stressful life events, the death of a family member, a loss of employment, end of a relationship, legal issues. We've always had these lover leaps, haven't we? When I grew up, I remember going out on the Hall Road on a house call with my father, and there's a quarry out there, and Dad described that rock quarry with its high cliff as a lover's leap. Now, I didn't know what suicide was as a young boy, but I remember that phrase. And people have been known to go to the edge of a cliff or something and jump off when a relationship ends. And we in the mountains here, we call those lover's leap. They're out there, and we know about them. So ending of a relationship or any stressful life event may precipitate a suicide. Sometimes people are unmarried or have limited social support. Men and women who are married and have family members around them are less likely to hurt themselves. So if we have to go through major events, it's good to go through them with other people as part of a support team. Well, let me talk a little bit. I have a few minutes to talk about some more medical things as a doctor. And I'm fascinated by this article that was first put together in 2005 regarding lithium. Lithium is a medicine that we use to help people with bipolar illness, people who need to keep their mood stable. It's in certain supplemental diets that people take. I've had patients come to me bringing some type of health tonic that they buy at a health food store, and they will identify and they'll know I'm interested that it has lithium in it. But lithium is perhaps one of the only substances that actually cuts down markedly, really, the suicide risk and suicide follow-through. And so a lot of times, again, in my practice with soldiers, I have prescribed 1 lithium a day, not enough to really treat bipolar illness or something like this, but just to tap something inside them that would then lower their suicide risk, and it works. It's quite remarkable. Another medicine that's been tried is olanzapine, recently gone generic. Been out there a long time, and it helps. It's related to the benzodiazepines, olanzapine. It helps anxiety. It helps command hallucinations, and it's been shown to make a difference. Another one called clozapine. These are just medicines to you. We don't use very much clozapine because it's a dangerous drug. It may lower the white blood cell count and leave people defenseless to fight infectious disease. You may have been watching TV. Many people bring things to my attention they see on TV. There'll be ads there that if you are taking an SSRI, it's an antidepressant medicine. There's about 28 of them, but anyway, there's a black box warning that if you take those, you may become suicidal. Of course, if you take them and you're pregnant, you may have a deformed baby and so forth. This is how it's usually presented on the TV before, urging someone to call a lawyer if they have a baby born with a defect. But the warnings are also there if someone, a loved one has died and so forth, they're taking an SSRI. Well, what the statistic shows is that, particularly in younger people, there is a increased risk, not necessarily in the completed act of suicide, but the attempted suicide. So there's something in that medicine that needs careful monitoring if a person is going to be on that. Let's talk. We have a few minutes left. Let me talk. There's so many things we could talk about in a program like this. And the governor of West Virginia, this new bill that has been passed, is now law, is that people who are going to be in the public arena need to know. I would say policemen, EMTs, teachers, people like this. I'm not sure who all the law will apply to. We'll have a 2-hour class. So we're talking here for 20, 30 minutes. There's much more to talk about. By the way, I was giving a class like this, about a 2-hour class, at the state level for the 911 staff, those who monitor our emergency calls. And I said, it's a fascinating thing. I called the National Suicide Prevention Hotline number, and I wanted to just to hear what they would say and identify myself and say, I'm giving this talk, and what do they suggest. And anyway, if you call 1-800-273-TALK, T-A-L-K, the first thing that happens is you will hear a voice saying, if this is an emergency, call 911. So certainly the people who manage the phone lines, 911, need to know, need a full 2-hour class, if not longer, about this. But just to say that if the final risk factor I want to mention then would be if someone has tried to hurt themselves and maybe they didn't commit suicide this time, they are at a 100 times greater risk of doing it again, particularly in the next year. So even then, someone needs to be under professional care, monitored carefully. There's a lot of things. It can be a support group. It can be individual therapy. You can work it out in various ways. But that's a known statistic, 100 times greater risk. Well, until the next time, this is Dr. Greenbrier-Allman thanking you for joining us on our program, Tender Loving Care. I'm glad that West Virginia is moving forward, a pioneer state really, to talk about suicide prevention. And I hope that you, as you care for each other in a neighborly way here in West Virginia, do ask your neighbors if you feel concerned about them, they have red flags, and I hope that it's well received, because we all want to live long and enjoy this spring and this beautiful time in West Virginia. We'll see you next week.